Okay. Well, good afternoon, and thank you for being here. I'm Greg Cox, Chairman of the San Diego County Board of Supervisors, and I want to thank all of you for attending this media availability on what is obviously a very, very important subject. We gathered here today because we want to give an update on the coronavirus, also known as COVID-19. Now, I can tell you 2 weeks ago, the Board of Supervisors took action to declare a public health emergency. 2 days ago, I happened to be in Washington, D.C. and had a chance to talk with Robert Redfield, who's director of the Center for Disease Control, and he was very complimentary of the things that we're doing here in San Diego in a proactive manner. As most of you know, last night, Governor Newsom declared a public health emergency for the state of California. So obviously, we're dealing with a subject that is extremely important, and we want to make sure we provide the best information we can to the public in regards to COVID-19. Today, we're going to hear from our local public health experts, who will be introduced in just a couple of minutes. We also have in attendance with us representatives from various sectors of San Diego who will be available to answer questions from the media. Our aim today is simple. We know a lot of people are concerned about this illness and that many have questions on what's going on with the virus now and what may happen in the future. That's why we're here with our top public health leaders today to talk about this issue. Now, just a couple of words of encouragement. We right now have about 1.3 million residents in San Diego County that have taken the flu vaccination. It's extremely important for the public, all members of the public that are medically eligible, to get a flu shot, because we know that the flu shot not only protects you from the flu, but those people that have the flu shot probably have a better resistance to the coronavirus, just from the standpoint that they won't have a compounding problem with coronavirus if that comes to be, and the flu. But I also want to put all this in context. We are in the flu season right now. And the reality is that we've had 17,935 cases of flu in San Diego County and 74 deaths. I offer that information not to minimize coronavirus, but to urge the media and the public to take a deep breath and remain in control and clear-headed about this illness. There are a lot of measures that we can take to prevent the spread of this virus, and we're going to talk about that today. I do want to reassure the public that we are working hand in hand with federal authorities and with local governments, state governments, and institutions on this issue. Protecting the public's health and safety is the #1 priority for all of us. And as you can see, when you look around this room, we are all working together as one region. Now, if people have questions in regards to the coronavirus, they can call 211 San Diego. They're prepared and have information available to disseminate to the public. We are still encouraging people as preventative measures to make sure you wash your hands, that you cover your sneezes and coughs, that you, again, get the flu shots, and that you, at the first signs of a cold or fevers, that you stay home and take care of yourself. And that's probably the best preventative thing all of us can do together individually and as a region. Specifically today, we're going to be working with 6 different sectors of the public engagement, and they're going to be sharing information. And that's going to include representatives from the schools, from businesses, from healthcare, from assisted living and skilled nursing homes, from homeless communities and homeless providers, and from local government. After we end this media availability, we'll be holding a conference call with elected leaders from throughout San Diego County, local cities, so that they'll also be on the same page in regards to the information that we're providing you this afternoon. Now I'd like to introduce our first speaker, starting with our County Public Health Director, our officer, Dr. Wilma Wooten.
Thank you, Chairman Cox. Good afternoon, everyone, and thank you for being here. Today, we want to provide an update regarding COVID-19 and how national and state activities are influencing our local actions. While the pace of cases is slightly slowing in mainland China, the number of cases is rapidly increasing in other countries, with U.S. travel restrictions now in place in South Korea, Japan, Iran, and Italy. The World Health Organization is currently listing over 75 countries and territories, reporting confirmed cases, with new locations being listed daily. Just early this morning, there were over 95,000 cases and over 3,250 deaths. In the U.S., early this morning, as of early this morning, and these numbers are changing almost every hour. The U.S. reported approximately 158 cases, and those numbers are climbing. And this includes 11 deaths, one of which is the first death in California from Placer County. In California, there have been 36 non-repatriated cases in 12 counties. While San Diego County has not yet reported any local cases, with this threat, both globally, nationally, as well as from surrounding counties, we feel it is only a matter of time before we see cases here in San Diego. Therefore, the time to prepare is now. We want to use this time wisely and emphasize important actions that the general public in various sectors can take. As Chairman Cox noted, the sectors we are focusing on are businesses, including many chambers of commerce and business organizations, healthcare, which includes hospitals and medical providers, assisted living and skilled nursing home facilities, schools, which includes childcare, K through 12, and colleges and universities. The homeless community and nonprofit and faith-based organizations that serve the homeless population, and so many others are also being engaged. Our regional government partners are also being engaged. Today, our intent is to emphasize key messages. The first, take action to prevent getting sick with COVID-19 infection by practicing good hygiene, good hand hygiene, washing your hands for 20 seconds, singing happy birthday twice, and not touching your face, your eyes, your nose, or your mouth after you've been out in the environment touching objects. Frequently clean your workspaces. And lastly, if you're sick, stay home. And let me repeat that. If you are sick, stay home. Find out what your policies are from your employee and where you work. My colleague, Dr. Eric McDonald, who was supposed to be here today, woke up with a cold and sore throat this morning, so he is not here with us, and he is practicing the messages that we give out to the general public. When you are sick at home, separate yourself from family members to prevent them from getting sick as well. Third, stay informed through the CDC's website, where you will find guidances for all of the various sectors that we've mentioned. Also, we want you to visit the county's website, where you will find fact sheets, a consumer version of our COVID-19 response plan, and daily updates. And if you have questions, we want you to call 211. Most importantly, we are asking schools, businesses, governments, and nonprofit and faith-based organizations to develop or update policies and procedures on sick leave and working or taking classes from home for schools. Organizations should develop or update their pandemic response plans or their business continuity of operation plan, or COOP. Planning for the future by implementing these actions now will help everyone get through the challenges that we think are ahead. As the local health department, we are currently engaged in key roles, and I'm going to go over these 3 key roles that we are engaged in to manage COVID-19. The first is monitoring travelers returning from COVID-19 affected countries. As of yesterday, cumulatively, we had monitored 424 travelers. 339 of those individuals have completed their quarantine, which is 14-day period. and 85 travelers are actively being monitored now. In addition, we are monitoring contacts of a recent Orange County case. We are also monitoring or following a small number of San Diegans who were on the Grand Princess cruise ship. Yesterday, we issued a KHAN alert with CDC guidance for management of our patients under investigation and for laboratory testing. The second task is managing patients under investigation, or PUIs. We have had a total of 44 PUIs. 26 were San Diego residents, 11 were from the federal quarantine individuals, not including the 2 positive cases. And we've had 3 non-resident cases, as well as cases from ICE and Customs and Border Protection. The third activity that we are engaged in is why we are here today, and that is planning and preparing for an outbreak or pandemic, which I have already shared information about things and actions that we want you to take. But in preparation for a possible pandemic, just as you would prepare for sheltering in place during an emergency, such as an earthquake, we want you to begin to build a supply of food, beverages, water, and medications for you and your family members, including your pets. So in closing, we want you to stay informed. Visit the county website at www.coronavirus-sd.com and call 211 if you have any questions about COVID-19. Thank you.
Thank you, Dr. Wooten. And next, I'd like to introduce Dr. Francesca Toriani, who is the leading infectious disease specialist at the University of San Diego Medical Center.
Thank you, Mr. Cox, and thank you for allowing me to speak here. I am going to address the healthcare response, and so I'm not only representing UCSD Health, but I'm also representing the other hospitals. We work very closely with CDC, with California Department of Health, and with San Diego Public Health. We work together in developing protocols and in diagnosing PUIs and everything that relates to that. And so I want to assure you that this collaboration and the communication is excellent, and I can just comment on that, having spent many, many hours on the phone with people both at the CDC and at San Diego Public Health and at CDPH. I think that all healthcare systems are in preparing for the next phase, which is community spread in our community. And so where mitigation strategies may be needed. And so we're working very hard at all of our protocols for diagnosing these patients, for where these patients should be admitting, if they need special care, ICU level of care, what do we do with them, how we treat them, which teams will be working. And really, we're working not only at keeping these patients safe and at treating them, but also keeping our health force safe at the same time. We are also working on expanding testing capacity. As you know, San Diego Public Health has now been testing these patients, but clearly the capacity needs to be expanded when we are going to test more patients who may have this disease. And so that will allow, if we at UCSD have testing capacity, then that will allow to other hospitals or other healthcare systems to access San Diego Public Health too, and so to have more people tested. The safety of our population and our workforce is our priority. And we're working and collaborating with public health and with everybody as one person. And so rest assured that this is happening here.
Thank you, Dr. Torini. Our next speaker is going to be from the County Office of Education, and that's the Superintendent of Instruction, Paul Gotthold.
Thank you. At this time, San Diego County schools are focused on prevention, preparedness, so that we can have a rapid response and seamless recovery should the coronavirus spread into the county and impact one of our schools. Since last week, schools have been actively sharing information with families and staff about how to prevent the spread of coronavirus and are reviewing their policies and procedures to ensure they are ready if a facility is instructed to close. San Diego County Office of Education has been providing resources and materials to help school districts, charter schools, private schools, and preschools prepare for a pandemic response. This preparation is not a one-size-fits-all. Implementation will vary greatly based upon the unique needs and circumstances of each respective school community. That is why we are in close contact with Dr. Wooten and the Health and Human Services Agency team and will continue to comply with all of their guidance. We fully understand that many of our parents and families are concerned about the potential spread of the virus in our schools. Our charge under state law is to stay open as long as our sites remain safe for students and staff, and we will honor that obligation until it is unsafe to do so. We encourage the community to stay current on the coronavirus situation by regularly checking with the San Diego County Public Health and the CDC so that we base our actions on facts and not fear. I would like to close by thanking all of our school employees across this great county for the work that they do and their continued focus on keeping our schools safe.
Thank you, Paul. Our last speaker this morning, almost our last speaker, is representing the San Diego Regional Chamber of Commerce, and that's the Executive Vice President and Chief Operating Officer, Jamie Bradford.
Thank you, Chairman Cox. The San Diego Regional Chamber of Commerce recognizes its role in helping the business community prepare for and do business during a potential outbreak. Just as we advise businesses to be prepared for natural disasters, we are recommending active preparation for COVID-19. If the coronavirus begins to emerge as a local threat, we need to encourage employees to stay home if they are sick, plan for a smaller workforce, and consider telecommuting and other strategies. Additionally, we encourage our members to be as flexible as possible with sick leave policies. When it comes to one's workplace, we echo the guidance of other speakers and the CDC in sanitizing all common surfaces and regular hand washing. Our members and other local businesses also can help by repeating and sharing these messages. If your business requires travel, we encourage you to check the CDC's traveler's health notices for the latest guidance and recommendations. In anticipation of COVID-19 outbreak in San Diego, employers should be flexible and prepare for a fluid and quickly changing situation. When implementing or designing outbreak strategies, we recommend that business prepare for employee absences, either due to personal illness, illness in a family, or cancellation of school or daycare. Cross-train personnel to perform essential functions, minimize close contact between employees and the public, or what has been called social distancing. Establish a communication plan to update information for employees and business partners. If you don't have a plan in place, there's no time like the present. Make it flexible and ask for employee input, share best practices with other businesses, and anticipate employee fear, anxiety, rumors, and misinformation. Finally, we encourage all of our members to stay up to date on COVID-19. The U.S. Chamber of Commerce and CDC are reliable sources for up-to-date information, as is the county's website. Thank you, and thank you to the county for organizing this.
Thank you, Jamie. As I mentioned, we have a number of representatives from other governmental agencies and nonprofits that are here who will be available to answer questions. Let me introduce them very quickly. First, from the San Diego County Medical Society, which represents more than 4,600 physicians in this region, we have their CEO, Paul Hedgie. Also from the Medical Society, incoming President Dr. Holly Yang. From the Regional Task Force on the Homeless, we have their Executive Director, Tamara Kohler. We also have from the county, the Chief Medical Officer, Dr. Nikki Fantides, who's going to be introduced in just a couple of minutes, and Emergency Medical Services Director, Dr. Christy Koenig. From the acclaimed Edgemoor Hospital, we have their Medical Director, Dr. Rebecca Farini. And from the County Office of Emergency Services, we have Director Jeff Toney, and the President and CEO of 211 San Diego, John Ohanian, is also here. Last, before we open it up to some questions, I would like to introduce my colleague on the Board of Supervisors, Supervisor Nathan Fletcher, who is also the Vice Chair of the Regional Task Force on the Homeless, and allow him to say a few words.
Thank you, sir. Thank you, Supervisor Cox, and thank you everyone who is here today. Over a month ago, we briefed you for the first time on our efforts around COVID-19 and the coronavirus. In the time since then, the county has moved aggressively, being one of the first local jurisdictions to declare a public health state of emergency. We also navigated through the repatriation to the United States via San Diego of individuals who had come back from China. And our efforts continue on an ongoing and daily basis to coordinate with the CDC, with the State Department of Public Health, with all of our local healthcare systems. And our doctors, nurses, health and human services staff and support are working tirelessly to protect public health. And even though the current risk to the public remains low, and even though we do not have any San Diego residents who have tested positive, we do continue to take this issue very seriously and are very vigilant as we move forward to do everything we can to protect public health and limit the exposure to San Diego residents. As has been mentioned, we have expanded our efforts in 6 key areas where we are working uniquely with 6 different groups of stakeholders that we think are uniquely situated to help us best respond. One of those areas is the homeless. As the Vice Chair of the Regional Task Force on Homeless, as a county, we are coming up with a plan of action to help ensure we are doing everything possible to protect the unsheltered populations. On Wednesday, March 11th, we will be convening a special meeting in the Regional Task Force on the Homelessness to get a presentation from the County Department of Public Health, but also to have a working meeting and discussion about what all of our homeless providers can do in coordination and cooperation and collaboration. What resources does the county have? What can we deploy? What should everyone know to ensure that we're doing everything we can to protect the unsheltered population? In addition to that, it's been mentioned a second group we're spending a lot of time is our daily efforts surrounding our healthcare community. We mentioned a third group is our schools and continuing to focus and prioritize what can we do with our schools. Also assisted living and nursing homes. And then I want to thank Jamie from the San Diego Regional Chamber of Commerce. The business community is that 5th key engagement group that we've been working with. The reality is if you feel sick, we need you to stay home. And the message to our business community is we need you to help facilitate employees who feel sick having the opportunity and availability to stay home. We don't want individuals to be faced with the situation where they feel like they have flu-like symptoms, but in order to pay the rent, they feel like they have to go to work. And so that's where we're asking the business community, if you have individuals who say they are sick and are sick, please work with them and help them to help ensure that they have the opportunity to stay home. And then the 6th group we're working closely with is all the regional governments. These are all of the cities, the state elected officials, the federal elected officials. After this press conference today, we'll be convening a telephone meeting with all of them to update them on everything that we know, along with things that we are asking them to do. We will be working with cities to provide and make available hand washing stations, and we will be asking them to help us and partner with us in siting those hand washing stations in an effort to protect public health. And then later this afternoon, myself along with county leadership will be meeting with San Diego Mayor Kevin Faulconer to talk about the issues that can do there. At the end of the day, we are doing everything we can as a county, not only as a county, but working in partnership with our state and federal officials and with these 6 key stakeholder groups to best protect San Diego. And we're asking San Diego residents to join with us. And it may not seem like a huge step, but it is a series of little things that will make a difference in terms of limiting the impact and exposure of this. So we are asking people, it was noted that 1.3 million San Diegans have gotten a flu shot. That means 1.8 million San Diegans have not. And we need those 1.8 million San Diegans to go get a flu shot. Because you don't want to get the flu, which 80 people have died of, You don't want to get COVID-19, you definitely don't want to get both. And the things that you do associated with the flu shot are the same things that will help make you be more aware of the dangers and risks. We're asking people to wash their hands, to use hand sanitizer if hand washing is not available, to stay home if you are sick, and to cover your cough. And those are things that every single person can do, and it's a series of those small steps, plus the things we're doing with each of our 6 core stakeholder groups, plus the things our Department of Public Health has been doing for more than a month, that we hope will put us in the best position to limit the impact and limit the damage. And so we appreciate all of our partners. We appreciate everyone who is here for all of their work and their efforts, and we look forward to continuing to provide you regular updates. Thank you.
Thank you, Nathan. And again, we can't say it enough. We encourage everybody to get a flu shot. We encourage you to wash your hands, to, instead of maybe shaking hands, get used to fist bumps and elbow taps, and to just be aware of the fact that if you do feel sick, please, please, please stay home and take care of your health, and don't risk the chance that you might be infecting somebody else. So now what I'm going to do is I'm going to ask Dr. Nick Efantides to come up. He's going to join us, and he'll be here to identify the proper person to answer any medical questions that you might have, and we would ask you to please identify yourself and your outlet as you ask those questions. So Dr. Nick.
Thank you so much, Chairman Cox. Thank you, Supervisor Fletcher. Thank you to all of our collaborative colleagues and medical professionals who are here to join us today. Together, we can do a lot more than any of us can do alone, and this is yet another amazing demonstration of our collective impact in protecting and promoting the health and wellness of our region. As we have done at previous conferences, we will now open up the floor for a few questions. I will call upon you, if you could please identify yourself, which entity you are with, and then state your question. I would ask for your patience because this is being broadcast live in various formats. I am going to restate the question, perhaps in a more succinct way, and then direct the answer and the appropriate person to handle it accordingly. So the floor is open for questions, please. Yes, ma'am.
Lori Devine, ABC 7. I want to know about this Orange County case.
Okay. The question is, we want to know about this Orange County case. To clarify some of the things that have been already communicated through the media, there is a criteria by which we define the location of a case. It is indeed true that recently there were 2 Orange County residents that were confirmed to be positive for the COVID virus. One of those individuals is actually employed here in San Diego County at a facility that many of you have heard about in the South Bay. That individual, prior to knowing that they had been confirmed, had minimal exposure and some contact with some of their colleagues at work. Those colleagues have all been identified, and they are currently on home quarantine being followed appropriately based on our routine protocol that we have gone through many times. In addition to those workplace contacts, there are a couple family members who also were exposed. Those individuals are also under self-quarantine, being actively monitored with our public health department through the routine process. And yes, there has been an individual who has been tested positive who was in San Diego, but to dispel any confusion, the reason for potentially some of the nomenclature, they are not a resident of San Diego County. There was travel history internationally that led to the facilitation and the decisions and the follow-up actions that we have handled accordingly.
So, Doctor, if I could follow up, because at least that was a little confusing for me. What we're hearing is that somebody went to Italy, came back from Italy, and went to work at AT&T. So then this person who you're speaking about got it there. Can you
No, that is not true. Let me clarify it again very succinctly. there is an individual who is a resident of Orange County who traveled abroad, that individual returned from travel abroad, went to their workplace in San Diego County, had a minimal exposure with a handful of those 5 employees. That person was not feeling well. That person returned home to Orange County based on the history of travel and based on their symptomatology. They were tested in Orange County and were confirmed to be a COVID case.
Sasha Fu, KUSI, I want to follow up on her question. How many of the San Diego County employees who were contacts in the workplace of this individual are on self-quarantine?
There are 5. And let me repeat the question, please forgive me. The question was how many employees of this individual who is an Orange County resident who works in San Diego County were exposed, who are currently under home quarantine and being actively monitored per protocol with our public health department. It is 5. Paul.
Why wasn't this individual under home quarantine? Why were they going to work instead of staying home?
I am not able to answer on behalf of that individual in terms of follow-up interaction and so forth with that individual from Orange County. I would have to direct those questions to another jurisdiction.
Where did they travel to?
A part of Europe that is considered to be a high-risk region.
Why can't you confirm it? Can you tell us whether it was Italy, and can you talk about what the business was? Can you confirm the business was? Because I think that we all have the same information. And we do have it confirmed from that, but can you tell us the business and what?
We are bound by patient confidentiality.
I am told that, I will confirm that the travel was to Italy. In terms of the business and because of the typical routines and so forth, I will not confirm that. I will tell you that our public health department is actively engaged. The appropriate individuals are under home quarantine and being monitored appropriately.
Adriana Rivera from Solomon. So if you cannot confirm the company, it's getting a little bit confusing for us because we heard from AT&T Public Relations that they had to close 6 stores here in San Diego because of a potential case of coronavirus. And you're saying that this person has been confirmed. So are we talking about another potential case here in San Diego?
I understand all the nuances. I will not tell you, I will say this, we are not talking about a different jurisdiction or a different company. That is consistent. And I will also say, and this is the reality of the current circumstances that we are under. Normally, these kind of communications, especially when they are to occur between health departments outside of the region, those kind of communications typically would occur health department to health department. In the haste of being responsive and in the abundance of caution, I think there was contact made with a business, and that business, in their posture and in the abundance of caution, made some decisions. As far as risk and concern to the general public, the contact was so limited and focused during a particular meeting that occurred for a limited period of time. And so hence we are confident that the appropriate people have been identified and are under home quarantine. Yes?
My name is Matt from KPBS. You guys talk about the time to prepare is now. Talk about people should be going out and getting food and other supplies. Why is that? And I guess how do you expect people not to take that as like sort of kind of panicky?
Sure. The question is in terms of the guidance that we are given to individuals to go and prepare, the time is now, and how does that translate in terms of minimizing the level of panic? Let me again be explicitly clear. We in San Diego County have yet to have any documented community-based transition. But based on what is happening in other parts of the world, and based on what is happening in other parts of the United States, we expect that it is just a matter of time. And just like with our declaration on Valentine's Day of the health and the health emergency, we are being proactive and seeking to do all we can to protect, to promote, and to be prepared accordingly. There is a needle to be thread, frankly speaking, between adequate preparation versus reactive, inappropriate response. I will also say that I think on behalf of our region, we, especially at the health system level, with our emergency medical systems and so forth, had the benefit and the opportunity to have lots of mobilization and preparation with what occurred during the quarantine situation of those who were brought to our local military base. Lightheartedly, I describe that as our spring training in preparation for what we are now facing and preparing for. Next question. Yes, sir.
Derek Stahl from ABC 10. I want to ask specifically about conventions, and maybe this is a question for County Public Health, but we saw a convention that canceled its event last week. What conversations and guidance has County Health given specifically to conventions, given that they draw people from all around the world? And if there is a social distancing policy, would conventions be among the first types of events to be?
Let me just restate the question, summarize it, and then I will turn it over to Dr. Wilma Wooten. The question is with regards to actions and directives that we may be in a position to take in terms of interventions related to social distancing. You focused on conventions. There are other such public mass gatherings that would fit into that broad category. Dr. Wooten.
Thank you for that question. Social distancing is a strategy. It's a non-pharmaceutical intervention that's used for mitigation. We have no cases in the community. We have no evidence of any community-wide spread, though as Dr. Ifantidi stated, it is really only a matter of time. But at this point in time, school closures or limiting gathering of large masses would not be a prudent recommendation. That is a strategy that we reserve once we have the early beginnings of local widespread or cases that we've identified. But we would not do that prematurely.
So what would be the threshold that you would look at to switch the policy and say, okay, social distancing is on?
So the question is, what would be the threshold or the switch for us to recommend social distancing? Again, that's if we had evidence of community-wide spread of and very early. If there are several cases very early and they were not epidemiologically linked, then we would utilize this particular strategy, whether it's particularly eliminating mass gatherings. Again, that's a tried and true public health strategy, but right now is not the time for it. It would be if we had cases to prevent people from gathering together and spreading the disease.
Thank you.
The first half of my question, which is, have you given any specific guidance to conventions in particular?
So we are in the process right now of developing letters and sending information to the various sectors, businesses, and conventions are a part of those businesses. There's guidance from CDC, so we are putting together all of those letters and sending out guidance and asking all of these sector partners to do what we've asked and shared with you here today.
Yes, sir.
Chris Generline from Times of San Diego. I had a question for Dr. Wooten or anyone else about, you mentioned stocking up a little bit, preparing. What does that entail?
Yeah, the question relates to some of the recommendations that we are now starting to make in terms of household stocking up and preparing of personal supplies. Dr. Wooten.
So how many people here have a disaster preparedness kit at home for fires? So that's the same thing that we're asking everyone to do, to prepare for an event that could potentially happen. And in this particular case, it is the event of having an outbreak or a pandemic, so that you have at least 2, 3, or 4 weeks of supplies from foods, beverages, water, any medications that you might need, as well as materials for your pets, and then also any other items that you use on a day-to-day basis. So what is it that you need to sustain yourself for a period of 2 to 3 weeks or more, that where you wouldn't have to go outside and interact with anyone else.
Yeah, and just to follow up on that, I mean, folks, the reality, we're blessed to live in California. It is a region of our country that is prone to emergencies, whether they be earthquakes, wildfires, other events. And so in some respects, as your public health stewards, we are looking at this as merely an opportunity to remind you of what we all should be doing routinely. There is nothing distinctive, there is nothing different, there is nothing special about this episode. This is good stewardship that every member of our community should be actively pursuing and be prepared for. Yes, ma'am.
With Univision San Diego. What can you tell us about urgent care facilities? We've seen some places that are putting signs that say, if you've been to Japan, Korea, Italy, do not come here, go to a hospital. So what are the conversations regarding healthcare?
Yeah, the question is with regard to urgent care facilities and what communications and so forth are being provided to them. I'm going to invite my colleague, Dr. Christy Koenig, the EMS Medical Director, to make some comments in general related to healthcare environment preparation.
Thank you for the question. Urgent care facilities are a really important part of our healthcare system, and we know that some people with symptoms or with concerns will go to urgent care facilities, and that's why we put in place proactively systems so that if a patient is very sick, as happened actually a couple days ago at an urgent care facility, then the provider there calls 911 to transport that patient to the hospital. We have screening at the level of the 911 dispatch that will identify that. The paramedics will respond wearing personal protective equipment at the appropriate level. The patient will be transported to a hospital who's given a heads-up notice that they're coming so they can prepare an isolation area and personal protective equipment to make sure that both the patient and the healthcare providers are safe. So we expect that as part of our system, that people will go to urgent cares, and we have emergency conditions in place for that.
Thank you, Dr. Koenig. And I will say again, because of what we recently went through, from our pre-hospital community to our outpatient community to the hospital community, we have been prepared, and we have gone through this process now several times and feel very confident in it. I'm going to take just 2 more questions. Yes?
Again from KUSI,
And then come in.
a couple of questions about testing. On Friday, Dr. Wooten told us we had about 600 test kits in the county. As of today, how many test kits do we have? He said we're getting ready to anticipate the arrival of more. By how many? And is testing still centralized with the county facility, or can local hospitals now also conduct those tests? And finally, how much does each test cost if the individual doesn't have insurance?
I'm going to ask Dr. Wooten to respond to that question. Basically had to do with county testing capacity, regional inventory, and the preparation that we have in terms of expanding that testing capacity, though we have it in San Diego outside of our public health laboratory. Dr. Wooten.
So as I stated, as Sasha stated, last Thursday we, for the first time, we had the capability or the capacity to run tests in our public health laboratory. If the test is negative, we're great. If the test is positive, it will be listed, and as you will see on the website, as a presumptive positive, and that has to be tested at the CDC for concurrence. How many tests do we have? Last Friday, we had about 600 tests to test 600 specimens. I think we're down close to somewhere over 400, but we will be getting additional test kits by the end of the week. And you had another...
About the hospital capacities.
Is it centralized only at the county?
Oh, testing capacity. Right now, it's only in our public health laboratory. There is no commercial test available as of yet, but that is on the fast track for the test to be available commercially so that other entities like hospitals or urgent care centers can also test.
Thank you, Wilma. Yeah, I've already chosen the person who's going to ask the last question. I also just want to use the opportunity related to the number of tests and PUIs and so forth We do have the dedicated website. We have shared multiple times. That website is now being updated at least 3 times a week. Yes, ma'am.
If there is some positive in our area, are the quarantine centers still going to be at the military bases, or have you guys also, rented out hotels, motels, other areas that will become quarantine centers?
Yeah, the question relates to the issue of if there is local transmission, the planning that is associated with developing quarantine capacity, and whether or not the military would be used for that purpose. I will answer that in saying that the use of the military base was a very unique and special set of circumstances that was done for our repatriated fellow citizens. The military is not in the future, currently to my knowledge, anticipated to be part of that response. In the context of the declaration of a statewide emergency, there is now a statewide effort underway in terms of assessing inventory. In reality, with individuals, as we are currently having, because most of them have a location of residence, for individuals who are under quarantine or individuals who become formal persons under investigation, our anticipation would be for those individuals to quarantine themselves at home. There are some planning efforts going on related to potentially coordinating locations for healthy family members to have somewhere to go if that was needed. In terms of broader quarantine designated capacities, we are working in coordination with the state in that regard. And with those comments, I would like to now turn the podium back to Chairman Cox. Thank you.
Thank you, Dr. Nick. Again, right now, our purpose in having this session here today is to inform the public. There is not a reason to panic, but we want people to be vigilant. We want people to do those things that they can do within their powers to try to avoid any contact and certainly any chance of them coming down with the COVID-19. The fact that our County Department of Public Health has now been certified to do these tests means that these tests can be completed in 4 hours as opposed to 3 to 4 days by sending them back to the CDC in Atlanta. So again, for the public, if they have concerns or questions, they can call 211. They can also do precautionary things to make sure they get a flu shot, to make sure they wash their hands, to make sure that they do fist bumps and elbow taps, to make sure that if they do feel sick, that they stay home and take care of their health. This is a time for people to take responsible action as individuals. Again, having a home health plan is just like having a plan in case of a fire or other disaster. You should have supplies on home that'll last you for up to 2 weeks. Water and food and dog food, medications, etc. We thank you for being here. Now, unfortunately, we have to go on a conference call with the elected officials in San Diego County to basically share with them the same information we've been providing to you here today. Thank you for being here. Appreciate it.
Folks, some of the speakers will be available after the phone call. And then there'll be county media here to answer the follow-up questions. So is the Senate speaker available? I'll get him for you.
Jeff.
Yeah. Is anyone available?